I know for a fact that a dialysis patient has the same problems, if not more than me. Plus, they have kidney disease, renal failure, that I cannot even fathom. I can never begin to imagine what that's like. I can try, but it's just not something that I think we can do until we're in that chair.
The recent recession led people to seek other job opportunities. A career in the healthcare industry as a dialysis technician was an obvious option.
I feel like this is a place for me to be and get the profession.
And while it would have been lucrative for dialysis education services to accommodate each potential student, a strong doctrine and a passion and commitment to quality patient care has led them to sift through the most qualified individuals.
Well, I can tell you that each and every prospect that comes into our door is screened pretty well. We definitely can appreciate somebody who's looking for a new career, a job, a secure life, and you know, that's kind of something that we've built on, is to secure your job for life, because this is a very secure career. But the reason it's secure is because there are people that are sitting in those chairs, and again, their life depends on real care, not just mechanics. Our techs show that kind of care.
Dialysis education students are trained to communicate with their patients.
Again, built into the training is a little bit of social skills. That is something I can say I missed in my training. We have a social worker that works with our program, and she puts a lot of effort and hours into the lectures to let our students know how much their communication skills matter, how much the smile on their face matters, how much understanding that you're going to have a hard day sometimes, and to an extent you still need to wear that smile. I hate to say fake it, but you put on a different face when you walk into a dialysis clinic, because the fact that a dialysis patient has the same problems, if not more than me, plus they have kidney disease, renal failure, that I cannot even fathom. I can never begin to imagine what that's like. I can try, but it's just not something that I think we can do until we're in that chair.
Professionalism. It's what sets dialysis education services apart from other schools.
Obviously, we're professionals. We have professional boundaries. We spend more time with our patients than most people spend with their families. A dialysis patient comes into treatment, let's say 3 times 4 hours a day. This is, a ballpark average. So you're spending 12 hours a week with one person. And we actually, as dialysis techs, work 12 hours a day. So it's easy to get comfortable with people. It's easy to see through the lines. And it's easy to be taken off of the straight line. So I think, outside of the rudimentary education, having professionalism in it, with a social worker, not just another technician or an RN, but somebody who's trained in professionalism, social skills, ethics, for example, it needs to be there, but it also needs to be a part of continuing education.
Dialysis Education Services prides itself in the highest level of medical and technical understanding.
We need to understand what our patient is going through. We have a dietitian and a diabetes educator to not only help us to understand the main cause of renal failure, which is diabetes, but also to understand the specifics and the difficulties that a patient would have adhering to a new diet, basically, as their kidneys have failed. We cover all of the Department of Public Health, the Centers for Medicare and Medicaid Services, recommended subject matter or required subject matter. We've brought in the best instructors for each area that we can. So we have, let's say, for anything that would be related to medicine anyways, or a nursing related lecture, we brought in a couple charge nurse and high-level RNs that have been working in the industry for many years. They're basically on a more administrative role at the time, but they're running clinics.
Each student is trained to understand his or her role in the life of a dialysis patient and to use his or her knowledge in providing the best quality inpatient care.
Dealing with the whole patient, understanding that dialysis is not the only problem. When you have renal failure, your life is turned upside down. From the day that you heard your kidneys fail, and I've talked with many of my patients, and we actually have patients come into the school and tell our students this. All they heard was your kidneys failed. And then it's, do you want to have this kind of dialysis? Do you want this kind of access? Do you want to do it at home? Do you need this medical and this and that? And they still said, all I heard was my kidneys failed. So it's important to us, for the people who come through our program, to be able to answer the questions when the patient is ready to ask them. That when the patient is ready to learn, when the patient is ready to talk with the social worker a second time, that a dialysis technician or a nurse would recognize and utilize the team appropriately. Our instructors are not expecting for a dialysis tech to change the diet prescription or to deal with the patient's psychosocial problems. But we do expect them to recognize and, again, utilize the team appropriately. If you play baseball, you really know what the whole team does. Even though you may not play third base, you know what third base is going to do. And that's our approach. That's the holistic approach that we take.